Welcome to the BrainShape podcast, hosted by Dr. Andrea Wilkinson, a show where we cut through the noise of the ever-growing, ever-changing world of brain health. What works and what doesn't, what's fact and what's fiction. We look at tips, tools, and techniques backed up by real scientific studies to help you keep your brain healthy and hopefully have some fun along the way. Now, here's your host, Dr. Andrea Wilkinson.
You're listening to the BrainShape podcast, episode number 19. Today, I would like to share with you some information that was originally a guest post on my blog, which, if you're interested, can be found at www.brainshape.ca/blog. The guest post was originally written by Jackie Cotton, a physiotherapist, and she talked a lot about the benefits of regular exercise and different ways you can get your body moving. Jackie has worked both in rehabilitation hospitals and in the community, helping people with neurological conditions such as stroke, brain injury, and Parkinson's disease, musculoskeletal problems, as well as individuals who have spent prolonged periods in hospital with multiple health problems. At the time she wrote the guest blog post, she worked with older adults in a rehabilitation context to maximize their physical function and ensure their safe reintegration back into the community. So today, I wanted to re-share some of the excellent information she provided about physical activity and resources on how to stay active in the community. Here we go. Let's talk about the benefits of exercise and different ways you can use to keep active. The benefits of physical exercise can be both physical and mental and are especially important for the aging population. As you age, there is a decrease in muscle, bone, and joint health, as well as an increase in levels of inactivity. Today, I'm going to cover the 7 benefits of regular physical activity. Number 1, exercise leads to improved mood and improvements in mental health. Exercise has been shown to decrease levels of anxiety and depression, as well as help to improve sleep and increase energy levels. Number 2, physical movement has been shown to have a positive impact on brain health and memory. As you age, changes occur in the brain that are associated with declines in cognitive and mental functioning. Physical exercise plays a role in preserving cognitive and mental performance in older adults. Number 3, exercise can lead to increased likelihood of living an independent life and a lowered risk of falls. Falls are actually the number 1 cause of injury in older adults and can result in lower levels of independence. Exercise can help to improve overall strength, balance, and physical fitness, which allows people to maintain an independent life for a longer period of time by helping to reduce risk of falls and injury. Number 4. Exercise has been linked to reductions in chronic disease prevalence and mortality. Physical inactivity is a primary cause of most chronic diseases. Exercise has been shown to decrease the risk of diabetes, cardiovascular disease, and some cancers. And exercise is medicine and can help lower blood pressure, improve cholesterol, and control blood glucose. Number 5. Staying active can help to increase opportunities for socialization. Exercising with other people is a great way to stay motivated, and it also provides you with opportunities to socialize with others and remain an active participant in your community. Number 6, unsurprisingly, exercise helps to improve muscle strength and bone health. Exercise can help to reduce rates of muscle atrophy and loss of bone density that naturally occurs with aging. By exercising and improving muscle and bone strength, you can help to reduce your risk of fractures that are common and often debilitating in older adults. And last but certainly not least, number 7, exercise can help to reduce the experience of chronic pain. It was previously believed that rest and inactivity was the solution for pain. However, recent studies have really begun to show that exercise can help to decrease the experience of chronic pain, such as lower back pain and fibromyalgia. The Canadian Physical Activity Guidelines for Older Adults, so that's individuals aged 65 or older, recommends an accumulation of at least 150 minutes of moderate to vigorous intensity aerobic physical activity per week. So what does that mean exactly? Well, moderate intensity exercise causes you to sweat a little and breathe harder. So this could be activities such as brisk walking or biking, whereas vigorous intensity exercises cause you to sweat and be out of breath. So this could be activities such as swimming or cross-country skiing. And don't worry, I'll be sure to include a link to the Canadian Physical Activity Guidelines in the show notes. So in addition to the aerobic exercises, so the 150 minutes that you're doing every week, it's important to also include strength training and flexibility exercises at least 2 of those days each week. If you're just starting out with an exercise routine, it's so important not to get overwhelmed by these recommendations. Start slow with low or moderate intensity activity, and then build up your activity time and intensity as you're able to do so. Going for a daily walk is a great place to start. And if you have any pre-existing health conditions, be sure to check with your doctor or a physiotherapist specialist for specific recommendations regarding exercises for you. When exercising, it's so important to do a warm-up and cool down to allow your body time to adjust to different activities and to help prevent injury. So when planning your weekly physical activities, try to make sure you include a combination of aerobic exercises, strengthening, flexibility, and balance. So what are aerobic exercises? Aerobic or cardiovascular exercise is defined by the American College of Sports Medicine as any activity that uses large muscle groups, can be maintained continuously, and is rhythmic in nature. Aerobic exercise should be done at least 5 days a week and includes activities that make you breathe heavier, such as walking, biking, swimming, dancing, or jogging. What do I mean by strengthening? Strengthening exercises do not have to be intimidating. Use your body weight, resistance bands, or small weights and try to focus on major muscle groups of your upper and lower body as well as your core. For some examples of strengthening exercises you can do yourself with minimal equipment, be sure to check out the link that I'll include in the show notes. What about flexibility? Flexibility is often overlooked, but can be maintained with simple daily stretches or activities like yoga. There are so many yoga classes available for a variety of ages and ability levels, so I encourage you to check out some classes that you have available near you. If you would like some examples of flexibility exercises that may be appropriate for you, again, I invite you to head on over to the show notes to check out some of the links that I've included there, and I hope that you find them useful. Last and certainly not least, let's talk about balance. Balance exercises are so important to incorporate into your weekly schedule of activities. To help improve your balance, you have to challenge it. So it's so important to do balance exercises in a safe environment where you have arm support as needed. There are many fall prevention exercise classes as well as Tai Chi classes that you can check out. And both of these focus on exercises to help improve your balance. You can also do balance exercises on your own, and I invite you again to head on over to the show notes where I'll provide some links to different places where you can look up some options to engage in balance exercises that hopefully will give you some suggestions and options that you can explore. It's always hard to build new habits and stay motivated. So let's talk about 3 ways you can use to help increase your likelihood of success when it comes to engaging in physical exercise and movement on a regular basis. Number 1, you're much more likely to continue doing an activity that you enjoy. So find something that you like to do. For me, that's running. I really enjoy being outside and running in nature. So that's something that I do on a regular basis and I enjoy it so much. So running and bicycling are my two favorite physical activity exercises. And I especially like doing them in the summertime. And that makes, when we have the winter months here in Canada, it makes it a little bit more difficult for me to engage in physical activity on a regular basis. So for me, yeah, definitely jogging and biking. And also another tip is to try to find friends or family that you can exercise with. This will help keep you motivated and accountable. Tip number 2 is to create a sequence of events that snowballs into each other. And I talked about this in episode 18, where I talked all about habit formation and how we create habits for ourselves. But the first step in the habit formation model is the cue. So that's the sort of item, the event that happens that tells your brain that now it's time to engage in the habitual behavior. So the first step is the cue, the second step is the action or the habitual behavior, and the third step is the reward. So when you create the sequence of events that snowball into each other, it should be the case that your cue leads you into performing the habitual behavior that you want to engage in. In this case, it would be the physical exercise. So the cue can be something as simple as putting on your running shoes. And in fact, the first step in the cascade of events, the cue should always be so easy that you can't say no. So the cue is you put your running shoes on, and now that your running shoes are on, it's now time to engage in the habitual behavior. So you got your running shoes on, now it's time to head outside and go for that walk. And finally, tip number 3 is to create a schedule for the week. This doesn't have to be a strict schedule, but I always find it useful to know when I have blocked time for my physical exercise. My recommendation, which is slightly different from the Canadian physical activity guidelines that I mentioned earlier, my recommendation is to move your body every single day in some way. 30 minutes, going for a walk even, taking the dog to the park, whatever it may be. Just know that you need to move your body every day. Knowing that you're expected to exercise daily makes it super easy to keep track of. But if you want a sample week of 150 minutes worth of activities, head on over to the show notes where we put together a little bit of a sample of an entire week's worth of activities that encompass and incorporate the 150 minutes of activities. There are many barriers to exercise, such as pain, fear of failure, not always seeing immediate benefits, thinking it's too difficult, or fear of the unknown. Some ways to push past these barriers are educating yourself about the benefits of exercise and a safe way to do it. Listening to this podcast episode is a great first step, but you can also speak to your doctor or a physiotherapist to learn what exercises may be best for you. There are many misconceptions about exercise causing pain or making you more tired, but the right exercises can actually help to reduce pain and give you more energy. Exercising with a friend or joining a class is a great way to keep you accountable and motivated, but also having other people with you may help you feel more comfortable and open to trying new things. There are many options for seniors to work towards the recommended physical activity guidelines and to stay active. So let's end the episode today with a little bit of a chat about some excellent resources that are available for you in Ontario, Canada. Number 1. Seniors aged 65 and older can receive government-funded physiotherapy services to help recover from illness, surgery, or injury. Physiotherapy services should be considered as a tool to help maintain physical function and flexibility as you age, and it can really help to assist in preventing injury. Number 2, the Ontario government also funds free exercise and fall prevention programs for seniors. So I'll include the link on the show notes page, which you can check out. Number 3 is the TIME program. So this is Together in Movement and Exercise program, which is run at various locations across Canada. Again, of course, you'll find the link on the show notes page. Number 4, you can look up the Fun Guide for ideas for drop-in or registered programs such as yoga, aquafit, dance, and many, many more fun activities. So you can either Google Fun Guides brochures or head on over to the show notes where I will be sure to put the relevant link. And last and certainly not least, you can go to the City of Toronto's website for up-to-date information on free local activities, such as joining a walking group. The take-home message is this: the benefits of physical activity and exercise are well researched and especially important for older adults to help reduce the risk of injury, disease, help to maintain physical as well as mental functioning, retain independence, and improve quality of life. It's recommended that older adults get at minimum 150 minutes of physical activity weekly, or as I like to say, move your body every single day. If you've missed any of this, you can dive into the show notes for this episode and all past episodes at www.brainshape.ca/podcast. To access the show notes from today's episode specifically, just type episode 19 in the search bar, and today's episode will pop right up. Thank you so much for tuning in. I hope that this episode highlighted all of the amazing benefits of physical exercise and gave you some tangible tips you can use to ensure you're moving your body and staying active on a regular basis. While the Canadian Physical Activity Guidelines for older adults recommends 150 minutes of physical activity per week, I recommend that you get into the habit of moving your body every day in a way that is appropriate for you. And maybe this just means walking around your block. The point is, get your body moving every day for at least 30 minutes. Don't forget to subscribe to the podcast so that you'll be notified every time we publish a new episode. And since we're a weekly show, I'll see you back here next week. In the meantime, please follow me on social media at BrainShapeTO, and be sure to let me know if there are any specific topics that you want me to cover on the podcast. And also, if you found this episode useful, please share it with a friend. Until next time, keep your brain in shape. And as always, it's been such a pleasure hanging out with you.